Making Babies in Your 40s, Episode 7. So how do you go about choosing the right fertility clinic for you? First, choose a clinic that treats patients like you. So if you're 40, ask how many 40-year-old patients the clinic sees. You want the clinic seeing hard cases. You don't want to be at a clinic which is only familiar with patients having far better pregnancy chances than you. Seeing the right clinic will more likely give you the opportunity to try using your own eggs. A lot of fertility centres want nothing to do with anyone over 42, and therefore they've never had a live birth from a patient over 42. So they will tell you that you don't have any chance. When 40-year-olds speak to IVF clinics, it's often very negative. The message is just use a donor or adopt. Partly that is to manage expectations, but it shouldn't be all negative in the early 40s. There should be more support for this age group. An arbitrary cutoff at 42 doesn't make a lot of sense. One day older than 42 as compared to one day younger doesn't make a difference. Obviously, months and years do. While the odds are low if you're in your 40s, if you want a chance to use your own eggs, you should have that opportunity, I think. I'm not talking about false hope here, just encouragement. And often encouragement will mean that you'll look again at what were once for you less desirable options in a more positive light. If it's all negative from the outset, it's very easy to close off to all options completely. Caring support is really needed. Negativity takes away hope that you'll one day make a family. At larger clinics, you're not really part of the mainstream. You're not in the typical ballpark range of age the clinic sees. So for that reason, you may likely gravitate towards the smaller clinics which offer more personalised service. Larger clinics operate on economies of scale and cater best to the vast majority of their patients who are perhaps younger. So bigger is not necessarily better. That said, there are specialists at larger clinics who specialise in older age fertility issues, but you just need to keep in mind that you'll be sharing the waiting room and dealing with nurses who more often than not see younger patients. On the plus side, you may benefit from the extra resources and the staffing, which may enable more appointments to be offered to you. So it really depends as to whether you go to a large or a smaller clinic on whether individualised care can be given to you from the doctor down to the nurse relaying the instructions of the doctor. And I think therein lies the real problem. Often with the big clinics, the doctors are so furiously busy as compared to a smaller practice. The test results are always conveyed by the nurses. And the problem with that is that test results mean different things depending upon your age. The same high or low numbers in a younger patient, whilst challenging, may not be as dire. The second reason to choose a clinic with older patients is to better your odds with tailored treatment to that group. You need a tailored treatment protocol. You don't want to be treated as a 30-year-old because you're not. You don't want to be dismissed as an outlier at 40 and left to live up to that poor prognosis. 40-year-olds typically have low ovarian reserve, low antral follicle count, few and lower quality eggs, fewer embryos, and fewer still that are genetically normal, and lower implantation rates with miscarriage. So it's really, really tough. You want to improve your chance of succeeding. So you should discuss how the treatment for you will differ. The right type of protocol for you means the right dosage and trigger time, the trigger time meaning the extraction day for your eggs, the right lab protocol, you need an outstanding lab, where the embryos are cultured, and for how long, and when exactly they will be implanted back. So the drugs, the timing of extracting your eggs from follicles, should you be lucky enough to have follicles mature, and the timing of putting the embryos back into your ovaries should be discussed. Pre-treatment should also be discussed in terms of supplements and acupuncture. Eggs grow 4 months before you see them in the ovaries. So you need to try and create a better environment for these aging ovaries. Supplements and acupuncture are not really a 2-week or 2-day thing, and they should be discussed with your doctor. You also need to look at the effect of sperm. Typically, older women partner with men who are older reproductively, and the problems can be significant. The third factor is choice of clinic are the particular treatments or services that can be offered to you. You may decide on these down the track, not initially. So for example, services like whether the clinic has arrangements with a donor egg bank and a donor sperm bank. You may also be interested in some of the latest therapies which have achieved some good clinical results. Here you need to be cautious because there are a lot of weird and wacky sounding add-on treatments. I think there's a sliding scale for add-on treatments. Some treatments have more clinical success backing them than others. So for example, some treatments have reported small clinic trial success and others have no measurable success. I think it's good to have healthy skepticism about experimental treatments, but if there is measurable success in small clinic trials that are registered and properly done, it becomes more relevant to you. I think a treatment in this category is ovarian rejuvenation, that is reawakening dormant or sleeping follicles, or platelet-rich plasma as it's called, PRP, where the doctor injects a fraction of the patient's own blood into their ovaries using ultrasound guidance. It's experimental, meaning investigational, with no solid conclusions yet because there are no large clinical trial results available in statistically large numbers, but it has reported success in small clinic trials offered at a few clinics. It's definitely an evolving area of knowledge as research results become available. It's not proven, as I said, it's investigational in the sense that there are no conclusions, but the impression is that it's effective in some patients, not all. And so in whom, and trying to find out who the treatment will benefit is why more and more trials are being done at clinics. If a clinic treats the harder cases, they're more likely to be interested in the treatments and research that help this age group. So whilst you may not have access to a clinic that's trialling these more experimental treatments that have shown some measure of success in small clinic trials, you want your specialist to keep abreast of developments that impact this age group. So quizzing your potential fertility specialist on the things that help patients with low ovarian reserve, even if it's experimental, will help you make a decision. Their bio might also give you a clue about their special interests relevant to you. So you want to do your treatment at a clinic which deals with the tip of the iceberg in terms of age and fertility severity. The fourth factor, I think, in choice of clinic is success rates. I actually put it fourth because success rates for clinics that see the hardest cases are going to be less impressive. Different clinics have different patient groups, and that feeds into their numbers. You're not comparing apples with apples if you look at statistics alone. A clinic whose median patient age is 43 is going to have a very different pregnancy rate of success to one whose median patient age is 35. 40-year-olds have terrible statistics, and that's a function of their age, not the quality of their treatment necessarily. Obviously, they need the best treatment, but even with it, the results will never be as impressive as they are for the younger cohort. If you can look at success rates by age, that is really useful, although the bands are often so wide as to make this difficult, or the bands are capped at 42 years. American stats have an over 40 category, which is more useful as a basis for comparison. Clinics tend to be highly regulated and are required to publish their latest success rates. So the data is reliable, but as I said, it's limited and difficult to decipher. How are success rates limited? Well, they're limited in how they're expressed. A lot of 40-year-old women who start fertility treatment do not make it to the finish line on a first attempt. By finish, I mean a successful embryo transfer. Yet pregnancy rates based upon a successful transfer instead of cycle start are the norm for published success rates. A 40-year-old is really interested in how many cycle starts resulted in live births at a particular clinic. The percentage is going to be lower and lower still if the median patient age is higher. How are success rates difficult to decipher? Well, it's because you should look at the percentage of egg retrievals that result in a single live birth, not a clinical pregnancy, because often patients miscarry early on due to abnormality in the embryo, particularly for the older patients, so you want to exclude those. The fifth factor often overlooked is logistics, the travel time to the clinic. Often you have early morning appointments and perhaps 3 in 1 week closer to the trigger injection, so travel time from your home becomes relevant, particularly if you're working. I hope these 5 factors help you in your choice of clinic. If you would like some practical questions to ask your fertility doctor, please listen to my next episode, which is called questions to ask your fertility doctor a primer. Thanks for tuning in.
Thank you for watching Making Babies in Your 40s. Would love to know what you think and what you would like covered. Please leave your comments and subscribe to my channel. See you next time.